Thank you so much for being here.
Thanks very much. Just so you know, I'm just going to turn my video off while I talk because I've got some wobbly internet. You don't really need to see my face anyway, do you? Yeah, I finished my PhD only a couple of months ago, actually. And as we've already said, my thesis was focused on social support, so the informal help that you get from friends and family after a loss to suicide. And I'm just going to talk about the key qualitative study that I carried out as part of that thesis today. And so I'll talk through the study with a focus on methodology, because I'm told that that's the bit that people will be most interested in. So I'll just quickly explain why I studied this topic for 3 years. I'm sure that many of you are aware that suicide is quite prevalent in our society. So there's about 6,000 people die by suicide just in England and Wales alone each year. So it's quite a significant public health issue. And there's lots of different studies that estimate how many people are significantly impacted by each suicide death. And there's quite a wide range of figures, but generally you'd say between 6 and 30 people are impacted by each suicide loss. And at either end of that range, that's still a lot of people. And there's a lot of potential negative impacts on physical and mental health when you're bereaved by suicide. And notably, people bereaved by suicide are more at risk of dying by suicide themselves. So it's really worth trying to help this group of people as much as possible. However, studies do show that there's quite a low proportion of people that access formal help for their suicide bereavement. So often people don't know what's available, or they can't find anything that's right for them. And in the UK, at least, specific support services for people bereaved by suicide are quite limited and almost entirely provided by the third sector. So that leaves most people bereaved by suicide relying just on social support to help them get through their loss. So it's worth looking at social support and trying to understand how it could work best. So there are some studies, but not loads, that have done this. They tend to rather simplify supportive relationships. So they'll designate a single person as being the receiver of support and the other people as being the providers of support. But they don't really take into account the fact that when somebody dies by suicide, the members of their social group are all impacted, but they're also the people that each of them would typically rely on for support. So you've got multiple people grieving, but also trying to help other grieving friends and family members at the same time, which makes for really quite a complex social landscape. And that's what I wanted to understand better in this study. So for this study, I really needed to understand what was going on within social groups in terms of the dynamics and the relationships and the support between individuals and social groups as a whole. So I started out reading about different approaches used in qualitative research to find something that worked, and I realised that actually there wasn't much out there. So I did come across a few methodologies, and kind of the most obvious ones are the ethnographies and the case studies that are commonly used more in anthropological research. And there's some clear instances of people doing autoethnographies with another social group member and collaborating to put together a single narrative about their family or their group or a shared experience or something. And then you have focus groups, which we see used quite a lot across health research, and they're good for getting quite broad opinions about things. But both of these methods, so ethnography type things and focus groups, they revolve around the construction of a shared narrative and looking at things that multiple people believe. And particularly with focus groups, you run the risk of perhaps getting a bit of groupthink and perhaps certain voices sometimes being drowned out by other voices. And that can be particularly challenging when you've got such a sensitive research topic like suicide bereavement. And so I also needed a method that took all that into account and also allowed me to look at the discrepancies in people's beliefs and opinions quite clearly. So I came across the dyadic approach to research, which is qualitative methodology that's been around for a while but hasn't been super widely used. It's where you carry out your study with pairs or dyad participants. And typically it's carried out for research studies that are interested in communication between two people or comparing specific beliefs or experiences. And often people are interviewed together so that in analysis you can look at how the interviewees interacted with each other as well as what they both thought. And similarly, there are multiadic approaches. They've been used even less widely, but initially the multiadic approach was developed to look at multiple relationships across a set of participants, so more than just a single dyad or pair. So because I wanted to look at friend and family groups who've been bereaved by suicide, I based my approach and my analysis off of a multiadic approach and what I'd read about them. But there's really only one or two papers out there that describe the actual process of analysing data from pairs or from groups. The best description of analysis I found was that, I'm going to butcher the pronunciation, Iskovits and Koren paper, although it was for dyads, not for groups. And so, yeah, most of the documented dyadic and multiadic studies, they interview participants together and they focus on discourse, and that's talked about. But I decided quite early on in my study that because my topic is so sensitive and conversations can be quite charged, that it wasn't really appropriate to interview participants together, so I couldn't really use that approach. So ultimately, I took a lot from the theoretical writing about dyadic and multiadic approaches, but I kind of ended up developing my own approach to analysis that suited my needs rather than following an established process. And so I'm sure that I'm not the first person to ever do this or something like this, but I haven't yet really found anything written about it anywhere. So any documentation of the process of analysing this kind of data in the way that I've done exactly. So I forged my own path a little bit, and I went through a fair bit of trial and error working out how best to work with my data and analyse it and understand what was happening. So before I get into analysis, I'll just walk you through the other parts of the study a little bit. So for this study, I interviewed 27 participants across 13 social groups. And these social groups had someone in the group who died by suicide, and I interviewed them all separately with the aim of understanding how social support played out within each participant's social group, as well as understanding how relationships within the group changed after the loss and how these changes related to social support. And my whole study, my whole project really was supported by a PPI group who were fantastic. They were mostly people who had been bereaved by suicide themselves, but also a few people who volunteered with or worked professionally within organisations that support people bereaved by suicide. And so this group for this study was involved in helping me put together my interview schedule and making sure the whole of my data collection and recruitment was always sensitive and supported people. And they were also involved in the analysis of my data. So recruitment. So recruiting for a study that needs groups of participants who know each other is certainly a bit different to recruitment for other studies where you're just looking for individuals. And I felt like the only GDPR-friendly way to do it was to advertise the study, and once one potential participant had showed interest, I asked them to nominate any other family or friends to take part, and for them to get in touch with me about it, because there's no way I could take people's contact details without their permission or cold call anyone. That would have been awful. So recruitment was definitely intensive, and initially I did have quite a low response rate to my efforts. I started out by only scheduling people for an interview once they had at least one other group member who'd signed up to participate with them and confirmed that, because I didn't want to have lots of solo participants and not be able to do this group analysis. But actually, I think that was quite off-putting for people, to be honest, on top of the fact that this really is quite a sensitive subject. And, with good reason, lots of people don't really want to relive a really challenging experience with someone they don't know very well. So halfway through the recruitment phase, I changed tactics, and I did start to interview people who hadn't nominated anyone else to take part with them. But I was always really transparent about the fact that I was particularly interested in group experiences. And generally, once people had done their interview with me and we built some rapport and they understood more about what I was doing and they knew that it wasn't, you know, an awful experience, they felt more comfortable introducing me to a friend or a family member, and they knew that they weren't getting someone else into a tricky or like an upsetting situation. And maybe that's something that seems fairly obvious in retrospect, but it really wasn't to me at the time. So I'm really glad I changed that tactic. And that like slow rapport building process and really putting time into building relationships with people, it worked really well, but it was quite time intensive. And actually I ended up recruiting into this study for just over a year, I think. So I was quite lucky that it was a PhD and I had the luxury of that time to really be able to do that well. So once I was actually like sitting down with somebody to interview them, I started out each interview with an exercise that aimed to get people thinking about their social group and who they were close to, and to let them do all of this in their own time. And what I used for this was something called the hierarchical mapping technique, which was developed by Antonucci in the 80s. And it's used as a tool for research on social networks, so social groups, groups of family and friends. So as you can see on the left, it's like 3 concentric circles, and people mark their friends and their family onto the map with like names or initials. And you place someone on the map depending on how close you feel to them. So I asked participants to do this exercise twice. So the first map they did was as their social group was on the day of the interview. And then the second map they did was as things were just before their bereavement. So it got people to think about their most important relationships and who they were closest to in their life, and how that might have changed over time. And I think that this was more manageable than if I just started out by like asking people specific questions, because it was something that they could have some time to think about and generate and complete at their own pace. And then once people had created their maps, we went straight into a semi-structured interview, and it started by using the maps and looking at the maps together and identifying any of the changes that had happened over time in any of the relationships that they'd marked down, and talking about whether or not it was related to their loss, and if it was, you know, what had happened and why was there that change, and how it may or may not relate to the support that was between those 2 people. And this often took up quite a chunk of the interview, but it set the rest of the interview up really well for some of the more specific questions I asked after that. So we talk about how things had changed over the course of the bereavement, because people were, participants were between 18 months bereaved and up to about 8 years bereaved. So there's quite a time span in there. And we talk about whether, you know, there were certain groups of people, so maybe people who didn't know the person bereaved by suicide, who were more or less supportive, and the kinds of supportive acts that took place, and, you know, what was most helpful, what was least helpful, things like that. And then I also asked a bit about formal support that participants accessed, and this was with the view to trying to understand how that formal support might differ from what people get from their friends and family, and what draws people to formal support, what prompts them to seek help in that way. So probably be remiss of me not to acknowledge the reflexive thinking and the positionality that went into this study. So I approached the study from the viewpoint of critical realist, and so I came into it wanting to understand each individual's truth and to understand how it may or may not differ from another person's. And I think if I came at the study from a different viewpoint, I might have asked quite different questions and elicited quite different data. I wasn't so much interested in the whole, like the phenomenon, more the impact it had on each individual and how that interlinked between people who knew each other. I also approached the study as an insider researcher, so somebody who has been bereaved by suicide. And I think knowing that possibly made participants a bit more relaxed about opening up about their experience, because they knew that on some level I had already some understanding of what they'd been through. But conversely, it also meant that I had to be really careful not just to use the study as a way to confirm my own beliefs. And so working with my PPI group and my supervisors was really important here to make sure that I was picking up on everything that was actually coming out from the data. So I kept a reflective diary throughout both the data collection and the analysis period, where I noted down my immediate thoughts about things. And I found it really important to write a couple of notes straight after each interview where I kind of thought about how I felt about the interview and how I felt about that participant in comparison to other participants from their social group, because it was really important to be aware of any biases that I might have. So, you know, like if I just connected with one group member more than another member, and there were times when people would tell me competing stories about the same thing, and I'd have to think really carefully about which group member I was inclined to believe and why that was, and actually whether or not that was fair. Generally, it wasn't just to believe one person over another. And I also had to be quite careful about not revealing anything that one group member had said to another group member, so that obviously I could maintain that really important confidentiality. So there were times when I was interviewing like a second or a third group member, and I had to make really sure that I didn't steer the conversation to an area that the first group member had talked about, because I thought that was really interesting, because I never wanted to give away something that somebody else might not know, or push people into talking about something that they weren't comfortable talking about or didn't want me to know. So staying as neutral as possible as I moved from interviewing one group member after another was really quite a conscious process and something that I worked really hard on. So, the analysis process. I would say that it involved a fair amount of back and forth, and I've set out the 3 stages here of it, but it wasn't really like a clear linear process of steps that I followed. There was a lot of back and forth between the stages, and the individual level analysis and the group level analysis happened somewhat in parallel. So first off, like I split the data up into 2 levels. So the individual level, where I compared the accounts of every participant against every other participant, regardless of what social group they were in. And then I had the group level, where I compared the accounts of participants against other participants in that same social group. And then I also compared the overall experience of each group against the other groups, so 13 groups. So for the individual level analysis, I just followed a very straightforward thematic analysis with inductive coding, generating a coding framework that slowly became more organized, and coding slowly became a bit more deductive. And this coding, it focused on like individual coping and on supportive acts and how people felt about these supportive acts and support in general. And then for the group level analysis, I actually started out by writing up case studies for each group of participants as a way to start thinking about patterns, both within groups and across each of the groups. And it really helped me familiarize myself with the data and get my head straight around what was happening. And then following that, I began to code all of the data to create a new coding framework that was separate to the one that I had for the individual level analysis. And this coding framework focused on interpersonal processes, so the stuff about relationships and dynamics and how people felt about each other. And to support this and to help me like directly compare participants within groups, I created a third coding framework that just contained all of the times that a participant spoke about another participant in their interview. And this was, you know, it didn't end up being like a super organized framework, but it did help me get an overall sense of kind of just the harmony within groups and understand individual relationships better and think about, you know, kind of the shared thinking and the non-shared thinking in that group. So I don't know, that might sound a bit messy to you, but I felt like all of these steps were really necessary for me and really helped me figure out what was happening. When it came to working with my PPI group, I didn't actually ask them to work directly with the data and the coding frameworks because there was a lot going on. But what I did do was create anonymized versions of the case studies that I had, and we kind of went through them together and we talked about whether or not they were kind of reflective of their experiences and if there were any things that, you know, were important but were missing from the case studies and things like that. And then I also kind of presented the finalized-ish coding frameworks to them, like the themes that have come out from that, and we talked about those and again if they were reflective and representative of people's own experiences. So I'll just whiz through some of the results. Won't be in depth because there were lots of results and there's too many to talk about here. But just to start with the maps, as I described earlier, every participant started their interview by drawing 2 hierarchical maps of their social group so that we could see how they changed over time. And these were primarily used as an aid for the interview, but I did actually also end up referring to them when I looked at groups data, and particularly when I wrote up the case studies. They were always a really good place to start when I wanted to look at whether the loss had prompted much social change in the group. So you can see here that I've made a very low budget GIF that represents 2 participant maps. So on your left you have a wife and on your right you have a husband who lost their son to suicide. And the shapes represent a network member, so circles are family and squares are friends, and then the movement and the change in colours that you can see in the shapes is kind of the change over time. So you can see on the left there's people moving out and new people being added to the network, and then on the right there's just positive changes, if you would call them that, so people moving in and new people being added. So you could use these maps for a bit of quantitative data if you were so inclined. You could maybe like count the number of people that people put down, or you could assign like numerical values to all the changes and work out like net gain and net loss, things like that. But ultimately I didn't end up doing that because it didn't really feel like it added much value for this particular study. And also I didn't place a lot of parameters around how participants used them, so people ended up using them quite differently. So some people put like whole groups of people in, and some people got very detailed about exactly where within the rings people went and things like that. So not really quantifiable data for this particular study, but really interesting and really useful context for the rest of my analysis. So some of the key things that came out from the individual level thematic analysis, people quite consistently said that the best kind of support was that which was offered proactively and was something that was an open offer, not just a one-off. And they also really valued people being accepting of feelings and emotions. And then people also talked about the key things that were seen as being particularly unsupportive. So when people avoided them, or avoided acknowledging the loss, or avoided talking about the loss, that was particularly unhelpful. And also upsetting if people asked like intrusive questions and showed a bit too much morbid curiosity. And then people primarily in a supportive role, they found that it could be quite difficult to offer all of the time and the energy that they felt that they needed to be an effective supporter. And sometimes people, actually often people also felt bit out of their depth, and they were worried that they might do harm rather than good because they just didn't really have any knowledge about what was best to do necessarily. And then there was also a clear pattern over time in terms of the type of support that people found most helpful. So I've drawn out the timeline at the bottom. So practical support was most useful in the initial weeks after the loss, until people were kind of ready to emotionally process what happened and talk about it. And in the long term, people most valued friends continuing to be involved in their lives, even if they were struggling with what was happening, and particularly continuing to acknowledge the loss and account for that in contact. And then beyond the themes that emerged from comparing every participant to every other participant, there were also themes that emerged from comparing participants within groups and across groups. And this is really where the multiadic analysis that I carried out really had an impact. I think even if I'd used a multiadic approach to data collection and interviewed friend and family groups, I don't think I would have picked up on some of these themes if I hadn't sat down and systematically gone through each group's data to look for patterns. And so for this study, this level of analysis is certainly the unique contribution to knowledge in the area. I've just picked out a couple of key things to show you here. They're focused primarily on relationships, but they show how relationships impact on support. So they add a level of nuance and context, I think, for the individual level results. So I found that there could be quite often fallouts or rifts within groups between certain group members. And typically this was related to differences in the way people understood and attributed meaning to the loss. And then within bits of social groups that stayed together and worked together, you often found that sort of a specific hierarchy formed quite quickly after the loss, where people viewed themselves being more or less bereaved than their other group members. And you can see it on the right here in the way that hierarchies form with mothers at the top and then working down through the family relationship types. And this tended to relate to who the group collectively focused supporting. And related to that, there were often two quite clear roles in each group. So somebody who was seen by the others as being most vulnerable to the negative impact of the loss, and often that related to the hierarchy and kind of looking to support people who were deemed to be most impacted, but it also could relate to other existing stresses or mental health issues or something like that. And then there was also the role of, I've never really found a great term for this, but the coper. And so this was somebody who didn't really express their grief openly to other group members, and so was seen to be coping really well, and they typically did a lot of the practical support for the group in the immediate bereavement period, and were a bit less engaged with the emotional support side of things because that just wasn't their personal coping method. And then finally, quite often you saw that individual relationships between two individuals were polarized. So where they had perhaps been some tensions or challenges before the loss, that tended to kind of break relationships down a little bit, and relationships that were strong and where support between two people already worked well, those relationships tended to blossom a bit. So I'll just end by kind of reflecting a bit more on this multiadic approach and thinking about some of the things that I've learned doing this. Hopefully I've described what's happened well enough that you can see that a multiadic approach is valuable, and particularly for research that looks at relationships and group dynamics. And for my project anyway, where I was focused on understanding that give and take of supportive relationships and looking at those changes after a loss, I don't know that I could have done this just by comparing individuals against individuals. Like for the group results that I just talked through, I think I would have picked up on some of the themes if I'd stuck with a straightforward thematic analysis, but by comparing accounts from multiple group members, I could verify things. So like if you take the hierarchy of grief that I talked through, one person would kind of allude to their own hierarchy, and I could see what other participants in that group were saying. So I could see if it was a shared belief and therefore like a shared hierarchy. or if one participant said that a group member had offered them a lot of support, I could compare that against what other participants in the group said, and therefore understand if that was the participant that might perhaps be the group's coper. And I did that kind of thing all the way through my analysis. So yeah, I think that this methodological approach, and particularly this type of analysis, could be applied to a whole range of different research areas. It's a great way to explore anything to do with dynamics. I think it could be helpful for studies that focus on phenomenology, especially like phenomena that are really subjective. And I was thinking the other day that, like in health research, I could see it working quite well for studies that want to evaluate or look at the experience of like group-based interventions or things like that. But there are definitely some additional things to think about if you're carrying out multiadic research, and quite a few practical challenges to consider. So, as I said at the beginning of this talk, recruiting groups of participants can be quite difficult and definitely requires a lot more logistical management, although I guess for this study, I think some of the challenges I faced were around the fact that it was a sensitive research topic. Another thing I touched on earlier was that I was always very conscious that participants knew that I'd be interviewing their friends and family. So I worked really hard to make sure that people felt that they could trust me to be confidential. And actually, to be honest, I was quite surprised sometimes at how open and honest people were, because they would tell me things sometimes that other participants in their group didn't know, and they just trusted that I wouldn't pass that on. So, you know, it's something that I really need to be conscious of, but I wouldn't say that it was like a barrier in my research. And then again, as I described, the whole process requires an additional layer of introspection and reflection than you might perhaps do for an individual level study. And I think the two things that I contended with particularly was the idea that it wouldn't ever be possible to have like a finished group or like a complete set of data from that group, because you could just keep working your way further and further out across a network of people. And there were sometimes key group members who didn't want to participate, so I never heard their point of view. And particularly in my case, it was the group members that perhaps fallen out with a lot of the other people within that group, and I never really got their understanding of what happened, and I think that's definitely missing. And I was also really aware of two group members telling me different things, as I said, so competing about accounts of the same event, or different perspectives on a relationship, and I just had to live with the fact that I'd never know perhaps what actually happened or what the objective truth was, and I couldn't just choose to believe somebody over another person because that suited me best. And again, as I said, the analysis process was quite complex, and it was definitely quite time intensive, so it does require a bit of commitment. And I ended up creating case studies as aids and using multiple frameworks and going back and forth between them all to make sense of things. And I definitely found that as groups got bigger, and my largest group was only 4 members, that the analysis for that group got exponentially more complex as you added in more voices that needed to be heard. And I would guess that around 4 or 5 group members, at least in the case of social groups, you might start hitting a saturation point in terms of how much more you learn about what's going on within those group relationships for each individual. And then the final hurdle that I've come across is publishing the data. So obviously a group becomes more identifiable the more you say about them. And if you're putting results into the public domain and including quotes from people and perhaps describing things like relationship type, a group very quickly becomes identifiable to themselves. And the absolute last thing you want to do is publish information that one group member might not know, or publish something that might cause tension between 2 people. So it goes without saying, none of the case studies I've ever written up will be published. And in my thesis, whenever I've used a quote from a participant that kind of seemed like it had contextual information that could make it recognizable, I made sure that isn't a quote about another group member or anything like that. And during my data collection phase, all of the participants that I worked with had the opportunity to read transcripts of their interviews once they'd been done, and so they were able to remove things from transcripts that actually they decided didn't want to be recorded and potentially used. And a couple of participants did do that. So yeah, there's a fine balance between despecifying all of the results enough to completely protect identities, but then also making sure that you publish a results section in a paper that is, you know, has the most nuanced bits of the data. So that's something I'm thinking about at the moment as I try to start publishing all of this. So just to conclude, as I'm really glad that I took this approach for my project. I wouldn't have learned what I did without using multiadic methodology. There are definitely challenges to confidentiality and additional hurdles to think about, but I think it's definitely worth it. And I really hope that more people begin to use this kind of methodology, and so it will appear in more published work, and there will become more guidance for research on how to do things, particularly analysis. And it will continue to become something that's more accessible and a more refined methodology. So a huge thank you to the researchers who supervised my PhD, and I know one of them is here today, so thanks, Nicola. And also thank you to the organisations that funded it, so ESRC and McPin, and there's some references there if you want some extra light reading. And that's it.
Thank you so much, Hannah. That was fascinating and so rich, and gave a lot of food for thought. We've had great engagement in the chat. So I think I will start with one of the questions that I think appears across a few of the comments, which was just about the diversity of your sample, and specifically, yeah, what was the makeup of your sample, and how did you kind of account for ethnic and or cultural differences across the groups?
Yeah, typically research in this area is limited in terms of its demographic heterogeneity. So you often get groups of participants that tend towards females, tend towards older people, and also tend towards like white British people. So I did try to work quite hard to make my sample more diverse. So I worked with different organisations, and particularly organisations that work with ethnic minorities and mental health, to try and recruit through there, because I myself am a white researcher and there's only so much that I can understand or do. So I did work with a couple of charities who kind of advertised for me and stuff. Sadly, I didn't actually get any ethnically diverse participants, so that's definitely something that really needs followed up and looked at, because as I'm sure lots of people can guess or know better than I do, this kind of group experience will be very different across different ethnicities, and things like religion and being a minority might impact on things. My sample was more diverse in terms of gender, and I could see there's a question about gender differences, and it was also pretty diverse in terms of age. So I had some quite young people and some quite old people. I think it was like 19 to 72 or something, so I had a good range of age there. So I tried. I failed in certain areas. There's always things you can do better, and if I had £1 million, I'd go on and do that better. But just to answer the gender differences question, really, I didn't really find much of a gender difference. I think men often tended to be, they were more likely to be like those copers in the group. And also, obviously, you could see in that grief hierarchy that I created, even when it was parents who'd been bereaved of a child and lost a child, it was still the mothers who were kind of seen as the most impact, and then it was fathers. There was definitely a difference, and there wasn't a perception that they were equally impacted. And I wonder if that's something to do with the way there are gender differences in how people express their grief and seem to cope and things like that.
Thank you. I think one other kind of overarching or a couple of questions that have a kind of overlapping group with them, I think, is around the difference between individuals and group perspectives on this. So where you were able to speak to one person versus a network of people, and how you sort of managed that difference of perspective, if there was one, between hearing from one person versus hearing from the group. So I think specifically the question from Alison about how you would relate the data from people to each other. Alison's question is, did you do any enhanced masking or anonymizing of the data, bearing in mind that you have doubled the info related to each situation, and if you paired any quotes, did you do that and let the participants know that you were going to be sharing information between each other or between the two people? I think you did deal with this when you said that you despecified quite a lot of the information in the reporting, but I suppose in the research itself, how did you go about relating individual perspectives to the group and sharing that information between each other?
So when I talked to participants about the study, I'd always phone them before I met with them during the interview, just to make sure that they understood what I wanted to do. And I did always explain to people about the group element, and I would always say, I'm going to keep everything as confidential as I can possibly can. I can de-specify everything that I can possibly de-specify, but I always made it clear that there might be a possibility that somebody they know might recognise them from, somebody from their group might recognise them because you don't know what are identifying things for a social group, if that makes sense. And so I'd always make it clear that I was going to do my best to remove everything that I could see was identifying, but there may be certain things that other people could figure out. And that was why I went back to people and I went, here is the transcript. If there's anything you definitely don't want other people to know, take it out. And most people were they were just fine with that, and they accepted that, and they were like, yeah, that's fine. I mean, most people didn't really say things that they didn't want other people to know, or other people didn't know, although occasionally they did. I didn't do any sort of, I haven't done anything fancier than that, basically. Maybe there are more worldly people who have great ideas about how to deal with that. It's a challenge that I probably will come up against more now that I'm trying to publish this data, because the thesis I'm publishing will be published as a redacted version. And so when I gave my thesis to the examiners, I didn't remove 1000% of all the identifying information, because I knew that the publicly available version, I would deal with that later and remove more things later. So it's kind of a problem I'm starting to think about, but haven't really come up with a good solution to yet. I know that's a bit of a rubbish answer, so sorry.
I don't think it's a rubbish answer. I think it's a challenge with research that is sensitive, and that when you are asking people for their very personal experience is going to be very difficult to anonymize. And so it's a challenge to qualitative research in general, I would say, not one that you are particularly doing well or badly at. Yeah. Another question, which is sort of linked across a couple of these comments, is about your reason for choosing this particular perspective. And the question specifically is whether you've got direct experience in relation to suicide yourself. The linked question is around how you analysed your reflections and if you integrated them into your project.
Yeah. So yeah, I would say that I do have experience of suicide bereavement. So my best friend died by suicide when I was 19. And that in itself, I think, made me approach the research slightly differently, because often the people who participate in this research, and often studies focus on family members, and the voices of friends who died by suicide aren't heard as often. And so, if you look at the hierarchy of grief, perhaps that's with a good reason, because we would say perhaps that friends aren't as impacted as much by family, but that really depends on individual situations, doesn't it? So I guess when I was working on data collection and analysis, I worked really hard with my PPI group, and as I said, to kind of keep talking with people about what I had come to the research with and what kind of preconceived ideas I had. And for example, I was like really passionate about getting some friends in this sample and having the voices of friends heard, because I was like, that's me, that's my story. But I had to be really careful that I wasn't just pushing that forwards. And so I have pages of stuff in my thesis where I've written about my own values and my own thinking and my own biases. And I've tried to make sure that that hasn't come out too much in the data. And when I did sense checking with my supervisors and with my PPI group, I just made sure that I wasn't emphasizing things that I wanted to emphasize because, you know, I felt like it was important. So yeah, I think that's a challenge for any qualitative researcher, whether you see yourself as an insider or an outsider. And perhaps it's just a little bit more of a conscious process when you're an insider.
Yeah, so just following on from that, Laura and Alison have asked whether you shared your lived experience with participants, either in kind of recruiting them or in the course of the interviews or the focus groups.
I did, yeah. I felt like it was quite important to like find a balance with that. So in the recruitment material I had, I said to people that I was somebody bereaved by suicide. But I tended not to really talk about it too much with participants, certainly not in the interview. I would talk about it a bit more afterwards, but I kind of didn't want anything to colour what people were saying to me. And I wanted to make sure that I kind of remained and seemed as neutral as possible. So I didn't kind of offer loads of information about what had happened to me, but if people asked, I was very willing to chat about that, especially after the interview. So yeah, people knew, but not in much detail.
Great. I think just to note that one of the comments is a really helpful paper about reporting qualitative data with identifiable information or not, as the case may be. Just for everyone to note that. I think one question I wanted to ask you was about movement between the hierarchies or in the concentric circles. On that diagram that you showed, there was quite a lot of movement between people being kind of, I guess, more closely or further away in the way that they were impacted. And I wanted to also specifically ask you about organizations, because I think what you sort of alluded to but didn't necessarily go in depth with, because this was about social support of families and friends of those who had been bereaved, just the kind of interaction with services or support organizations, either prior to or after bereavement, and just if you could talk to that a little bit as well.
Yeah, yeah. I one of the other things I found was often there was quite a lot of individual change in how you as a person kind of just perceived the world and what was important to you and what you valued after your loss. And for a lot of people, they got involved in mental health charities and bereavement charities and things like that. And some people went as far as, there was a couple of people who kind of have even set up their own charities or their own fundraising organizations. And so that becomes a really important part of your life, whereas it wasn't maybe so much an important part before. And you create bonds with other people who are involved for the same reasons, and you meet people who've been, you know, bereaved by suicide or impacted in that some way. And so that can often become quite an important part of your social life and a part of your work life sometimes. So that was quite a common thing where you saw those like organizations come into people's social networks. And then also people did talk a lot about their relationship with their workplace and their colleagues, and often line managers after their loss, and the return to work, which sometimes could be really challenging, and often people felt like it was too soon, but they were kind of forced back into it. And people had really different experiences of going back to work and kind of perhaps not relating with colleagues in the same way that they could before, and perhaps ending up with quite challenging relationships with line managers who themselves weren't supported or weren't trained in how to help somebody bereaved by suicide as they return to work. And also, I think, you know, I asked people a little bit about formal support, and the most common formal support that people accessed was peer support groups, where you get, you know, a bunch of people who've been bereaved by suicide sit down and chat together about what things are like for them. And often there's like a bridge where peer support group members become your friends. And again, you kind of, your initial bond is because of that shared experience and that shared challenge and that understanding that you both have of life. I could talk about this forever, but I'll stop.
I think I could listen to you talk about it forever. It's really interesting. I think one question just to possibly wrap up and then check if there are any others was just about if you have any sort of top tips or specific advice for researchers who might like to be starting to use these methods of talking to people in pairs or groups and linking their experiences together in a networked approach. So I suppose, yeah, if there are specific lessons that you could share having gone through it.
Yeah, I think definitely factor in extra time at each stage than you would have for like an individual level study. So as I said, around like recruiting and finding people who you can work with, and then also at the analysis stage, that definitely took me lots of time. And as I said, I think that there's quite a lot of trial and error in finding a process that works for you. Like the thing I did worked for me for my particular study, but perhaps you might be looking at something slightly different. So as I said, like a lot of those studies kind of look at discourse and look at, you know, participants interviewed together where and how they interact with each other. So that would be a very different kind of analysis, I think. I actually, someone else in my department, Billy Lever-Taylor, did her PhD like a year and a half ahead of me. And her project was focused on dyadic analysis. So I sent her a lot of emails and demanded a lot of her time to get her advice. So if you find somebody who's like written a paper on that methodology, just bother them until they'll speak to you and give you some advice and share their thoughts, because you know there isn't that much written out there. And also, if you're doing something, please try and publish a methodological paper on it. I'm trying to do that at the moment, and I think we need more of those methodology papers out there, which would be really useful.
Well, on that note, Laura has said that she's doing similar research with groups where a young person has made a serious suicide attempt and she'd love to discuss further. So I think you might find someone is taking your advice and following up with you after this. And so are you happy to be contacted over Twitter or otherwise to discuss your work?
Yeah, I don't know if my email address is somewhere. If you Google me, you'll probably find an email address, or yeah, talk to me on Twitter, and I'd love to chat to anyone who's interested.
Great. I'm just going to kind of generally throw it out. Does anybody have any final questions for Hannah before we wrap up?
I think we're all good.
I think we are.
Hannah, did you want to say your Twitter handle in case anyone doesn't know it, just so that they can find you easily if they need to?
I'm going to be honest with you, Holly. I don't know the Twitter handle off the top. Do you know my Twitter handle?
Do you want me to share it in the chat just now?
Yes, please. I don't use Twitter that much, but I will respond to messages. I'm sorry.
Well, then all that remains for me to say is, Hannah, thank you so much for such a brilliant presentation. It is phenomenal work. It's been a great talk and we've absolutely loved having you speak today. This is part of the QHRN Seminar Series, and so if you subscribe to either our JISC mail or follow us on Twitter, you can hear about our upcoming events. Hannah, thank you for your time, and thank you to the audience for joining in and providing such rich discussion and engagement with this topic. And I hope you all have a good day.